The issue here is that the bill that's moving through Congress, proposed by congressional Democrats, would ban expansion of existing and construction of new physician-owned hospitals that didn't have a Medicare provider number as of January 1st, 2009. In other words, the government has chosen a date in the past to put a policy in place that would, in effect, change the rules in the middle of the game and damage our health care in the process. This would essentially eliminate any physician-owned facilities that obtained their Medicare provider number after January 1st of this year or that are currently under construction. All these hospitals have played by the rules and followed the law, and none of them have done anything except try to expand access to care in our fast-growing communities. Right now, there are over 100 hospitals in America that would be affected by this retroactive date and provision, but Texas bears the greatest brunt of this. 40 Texas hospitals would be closed. 40 hospitals that employ nearly 15,000 or will employ nearly 15,000 Texans, including many of them here in southeast Texas. These Texas hospitals, by the way, have spent $510 million to date in construction and investment in facilities that the government would close down by changing the rules. Here at St. Luke's, I'm going to leave the discussion and the descriptions to David and Debbie, but construction will be completed later this year on a real fast track that's a compliment to those who put the project together for St. Luke's and is moving it straight ahead. This is, I can tell you, the St. Luke's facility, much needed facility for our community, one of the fastest growing areas in the state. It will bring, I believe, 30-bed expansion of the existing full-service hospital. Will focus on cardiovascular and orthopedics. I'm going to let Debbie and David talk about the impact, but it is significant. They're not alone. Just a mile down the road down here in Shenandoah, Reliance North Houston Hospital. This is one I toured here just a few weeks ago. It would be affected by this, again, retroactive date that's in the health care bill. This hospital would not be grandfathered because it missed the deadline by 23 days. This hospital was up and running before January 1st, but it didn't have its Medicare provider number. We got involved to try to get that moving and get it out from that pile of red tape, but Washington dragged its feet. They finally gave it to them 23 days after January 1st. So, because the government dragged its feet and Congress is picking the arbitrary date in the past for this provision, that hospital would stop running. That's an investment of $28 million, provides 150 good-paying jobs to our community, has a payroll of over $7 million, and it generates a lot of tax revenue for our local communities. So both of these hospitals are not alone. They're 2 of 40 across the state of Texas, but the fact of the matter is we can't afford to lose these 2 facilities. We can't afford to lose any of these facilities. I'm going to close, after we listen to some of our speakers, I'm going to close on what the solution is, what Congress ought to do to fix this problem and make sure that it doesn't cost us jobs here at home. With that, let me introduce the Senior Vice President of St. Luke's Episcopal Healthcare System, David Koontz. David.
Thank you, Congressman Brady. We are all very appreciative of Congressman Brady's championing of the importance of permitting physicians to continue to collaborate and even own the facilities in which they practice medicine and care for their patients. St. Luke's Episcopal Health System prides itself on its legacy of collaboration with physicians, which is most recently expressed in several of these joint venture projects that we have with physicians in the local communities around Houston. The joint ownership model fosters an opportunity for greater understanding and mutual respect between hospitals and the physicians that work with them in rendering care to the patients. It's harder to achieve that level of mutual understanding in the traditional model or the more corporate-centric models that have often served the larger metropolitan areas. While we all agree that there are elements of the healthcare delivery system that can be improved upon as we enter into this health reform debate, one dimension that has proven to be very effective in serving the needs of the community is local governance, adhering to local values with local accountability. Ownership participation by community physicians really helps strengthen this model. St. Luke's is in the midst of an expansion strategy to help bring its special brand of care to the suburbs and to provide greater choice to the communities and their physicians. In particular, we have several models that we've already engaged in out there. One is one where we have hospitals wholly owned by the St. Luke's Episcopal Health System of the Episcopal Church's Diocese of Texas. Those hospitals are the St. Luke's Episcopal Hospital and Texas Medical Center and the hospital here in the Woodlands, St. Luke's Woodlands Hospital. The next model that we've demonstrated to be very popular with the local medical communities as we expand has been the St. Luke's Sugar Land Hospital and the St. Luke's Hospital at the Vintage, currently under development. That hospital, speaking to Congressman Brady's point, has another 2 years of construction ahead of it. We've already received over $100 million of financing. Physicians have put some of their own money at risk, and the current draft of the legislation would put that entire project, those jobs, and $100 million plus at risk. A third model is one represented here on the Woodlands campus at the St. Luke's Lakeside Hospital, where we've worked with the cardiovascular surgeons and the orthopedists in this community and tailoring a facility that meets the special needs of their patients. The major thrust of the policy debate underway involve expanded access and reduced waste. Expansion through hospital collaboration, where physicians put their own money at risk, is one of the better ways of trying to align the interests as we try and achieve these policy objectives. And it's important that we support legislators like Congressman Brady, who have demonstrated the courage to champion pluralistic health care, expanded choice and collaboration between hospitals and their physicians. And with that, I'd like to turn it over to Debbie Sukin, the CEO of our Woodlands campus.
Let's clap. What the heck?
Thank you and good morning. St. Luke's The Woodlands Hospital is a 150-bed general acute care hospital that has been serving the Woodlands community for 6.5 years, during which time we've developed an excellent working relationship with our physicians here in this community. St. Luke's The Woodlands Hospital continues to expand in conjunction with the development of St. Luke's Lakeside Hospital. Montgomery County is one of the fastest growing areas in the country, and our system continues to invest in this community, campus, and specifically our general acute care hospital in order to continue to meet the demands and expectations of our patients. St. Luke's Lakeside is a result of our responsiveness to consumer interest in having higher quality specialized services available close to home, and physician interest in having a say in how and in what way they deliver their care. In many ways, this is similar to the Texas Heart Institute's development 40 years ago, which just this past week hit number 5 in U.S. News and World Report with regard to their heart program. And this, we believe, is an excellent model, once again, a physician partnership, and really showcases that if the right individuals in our system, being the leaders, is the right individuals to decide what's best for their patients. Best-in-class orthopedists and cardiologists sought out St. Luke's to develop a unique environment, focused on providing care in a different environment from a general acute care hospital. We welcome the opportunity to work with these physicians, whose mission surrounds quality and are driven to continue to practice innovative medicine in this community. St. Luke's Lakeside is a $50 million investment in this community. It will generate 150 jobs, and this project will be complete in 40 days. September 28th, we will see our first patient. Thank you.
Thanks, Debbie. Well, think about what she just said. $50 million investment, 150 new jobs, tax dollars for the community, more medical care for our community, all stopped, halted in its tracks because of some arbitrary date that someone chose in Congress to try to put into this law. That's what we're here to stop today.